Geriatric Psychopharmacology for PMHNPs. A case-based workbook for safe and effective prescribing in older adults. By Ashlee Sally Williamson and Victoria Denise George. And narrated by Madison G. This book is intended for educational and informational purposes only, and is designed to provide general information about geriatric psychopharmacology for qualified healthcare professionals. The content should not be considered as a substitute for professional medical advice, diagnosis, or treatment. Readers are responsible for making their own professional judgments about patient care based on their clinical expertise, patient assessment, and applicable standards of care. The authors and publisher disclaim any liability for decisions made based solely on information contained in this book. All medication dosing, prescribing decisions, and clinical interventions should be based on current prescribing information, institutional guidelines, and individual patient assessment. Drug information, dosages, and treatment recommendations may change after publication. The names and scenarios depicted in this book are purely for illustrative purposes only. Any resemblance to actual persons, living or dead, or actual events is purely coincidental. Case examples are composites created for educational purposes and do not represent actual patient encounters. While every effort has been made to ensure accuracy of information at the time of publication, medical knowledge and guidelines evolve rapidly. Readers should verify current information through authoritative sources and recent literature. Complex clinical situations may require consultation with specialists or additional resources beyond the scope of this text. This book does not replace the need for appropriate professional consultation when indicated. The authors, publisher, and distributors of this work disclaim any liability for any injury, damage, or loss that may result from the use of information contained herein. Section 1. Foundations of Geriatric Psychopharmacology. Chapter 1. Principles of Geriatric Pharmacology. The human body tells a story of change across decades, and nowhere is this story more pronounced than in how medications behave differently in older adults. You might think prescribing psychotropic medications to a 75-year-old follows the same rules as treating a 35-year-old, but the reality paints a far more complex picture. The aging process transforms every aspect of how drugs move through and affect the body, creating both opportunities and hazards that demand.
Sample complete. Ready to continue?